Did you know that your tongue can tell you a lot about your overall health? What color is your tongue? Is it red, white, yellow? These are all important questions. Today we're going to look at common tongue problems and their causes. There are many diagnostic methods in medicine, but one of the oldest and most basic is looking at someone's tongue. In Chinese medicine, the tongue is a primary diagnostic tool. When examining your tongue, doctors will look at its color, shape, size, coating, and any other abnormalities to help determine what is out of balance in the body. Your tongue has no bones, so it's totally dependent on your muscles to give it its shape. This means that changes in your tongue can be a sign of various diseases or imbalances within the body. Let us take a look at some of the possible meanings behind tongue colors and coatings, and what they might say about your health. A healthy tongue should be pink, mid-red in color, and feel pleasantly moist. The color comes from the blood that nourishes the many muscles that make up the tongue. The surface of your tongue should have small bumps called papillae, which help with taste and digestion. These papillae contain taste buds and glands that produce saliva. If you look down at your tongue and it appears red and raw, you may be suffering from glossitis, an inflammation of the tongue. Glossitis can be caused by nutritional deficiencies, autoimmune disorders such as celiac disease, thyroid conditions, or diabetes. May also have developed a bacterial or viral infection. People with anemia often have pale tongues because there is enough healthy red blood cells to give the tongue its color. If left untreated, it can lead to fatigue, shortness of breath, dizziness, and chest pain. A pale tongue can also be caused by liver disease, low iron levels, poor circulation, or dehydration. So make sure you drink lots of water every day. If your tongue is swollen, it could be a sign of heart failure, iodine deficiency, allergic reaction, or kidney disease. Swollen papillae can cause food to stick to your tongue and make speaking difficult. Some people develop a furry white tongue due to a bacterial overgrowth of candida or a yeast infection. This type of tongue coating is harmless and usually goes away on its own. However, if it persists, you may want to talk to your doctor about taking an antifungal medication. Many people worry when they notice a white tongue because they think it's a symptom of something serious like cancer. While a white tongue can be a sign of precancerous lesions, this is rare. Most often it's caused by poor oral hygiene, dehydration, or smoking. For example, smoking can leave a white film on the tongue, making it appear coated. Excessive smoking can also cause chronic halitosis, bad breath, which can lead to social and psychological problems. Smoking is one of the leading causes of chronic obstructive pulmonary disease, COPD, which causes symptoms like dyspnea, trouble breathing, wheezing, and chronic cough. COPD can lead to respiratory failure and death. If you smoke, quit now before it's too late. A black tongue is not common and can be caused by certain medications such as bismuth, subacute colitis, and gastrointestinal disorders. It may also indicate heavy metal poisoning or a vitamin B12 deficiency. Black hairy tongue is a harmless condition caused by a buildup of bacteria and food debris. It occurs when the papillae become enlarged and elongated. People who use tobacco or who wear dentures are more likely to get black hairy tongue. The condition is easily treated with good oral hygiene and an antifungal mouth rinse. A blue tongue indicates poor circulation, a heart or lung condition, congenital heart defects, or the presence of methemoglobinemia. Methemoglobinemia is a blood disorder in which the oxygen carrying capacity of the blood is reduced. There are several types of methemoglobinemia. One type is caused by an inherited inability of the body to metabolize nitrates. Another type is acquired when someone is exposed to high levels of nitrates or nitrites in drinking water. Certain chemicals and medications can also cause methemoglobinemia. These include high concentrations of benzocaine, dapsone, lidocaine, nitrates, nitroprusside, phenacetin, and prilocaine. Symptoms of methemoglobinemia can vary depending on the severity of the condition. Mild cases may not cause any symptoms at all. In more severe cases, symptoms may include shortness of breath, headache, lightheadedness, nausea, vomiting, palpitations, blue or gray skin color, and cyanosis. Cyanosis is a bluish discoloration of the skin that occurs when there is not enough oxygen in the blood. Methemoglobinemia can be treated with intravenous methylene blue. Many people wonder what causes a yellow tongue. Well, it can be caused by several things. The most common cause is smoking. Nicotine and tobacco smoke cause an increase in mucus production, leading to a yellow or green coating on the tongue. Other causes of a yellow tongue include Crohn's disease, ulcerative colitis, gallbladder disease, hepatitis, cirrhosis, pancreatic disease, diabetes, mellitus, lactose intolerance, gastroesophageal reflux disease, GERD, oral thrush, Crohn's disease, liver disease, chronic obstructive pulmonary disease, and cystic fibrosis. Crohn's disease is an inflammatory bowel disease that can cause inflammation in any part of the digestive tract. Symptoms of Crohn's disease can vary depending on the severity of the condition. Mild cases may cause abdominal pain, diarrhea, and weight loss. More severe cases, symptoms may include fever, fatigue, malnutrition, and fistulas. Fistulas are abnormal connections between organs or between organs and the skin. Ulcerative colitis is another inflammatory bowel disease that affects the colon.
Ow.
Symptoms of ulcerative colitis can vary depending on the severity of the condition. Mild cases may cause abdominal pain, diarrhea, and rectal bleeding. In more severe cases, symptoms may include fever, fatigue, weight loss, and toxic megacolon. Toxic megacolon is a life-threatening condition that occurs when the colon becomes severely inflamed and dilated. Symptoms of gallbladder disease can vary depending on the severity of the condition. Mild cases may cause pain in the right shoulder or right upper abdomen. In more severe cases, symptoms may include fever, jaundice, and clay-colored stools. Jaundice is a condition in which the skin, whites of the eyes, and mucous membranes turn yellow due to a buildup of bilirubin. Bilirubin is a substance that is produced during the normal breakdown of red blood cells. When there is a problem with the liver or gallbladder, bilirubin can build up in the body and cause jaundice. Clay-colored stools are a sign of pancreatic disease. Pancreatic disease can cause a variety of symptoms, including abdominal pain, nausea, vomiting, weight loss, and diabetes mellitus. Lactose intolerance is a condition in which the body has difficulty digesting lactose, a sugar found in milk and dairy products. Symptoms of lactose intolerance can vary depending on the severity of the condition. Mild cases may cause bloating, gas, and diarrhea. In more severe cases, symptoms may include abdominal cramping and nausea. GERD is a condition in which stomach acid backs up into the esophagus, causing inflammation and irritation. Symptoms of GERD can vary depending on the severity of the condition. Mild cases may cause heartburn and regurgitation. In more severe cases, symptoms may include difficulty swallowing, chest pain, and erosive esophagitis. Erosive esophagitis is a condition in which the lining of the esophagus becomes damaged and eroded. Oral thrush is an infection caused by a fungus called Candida. Symptoms of oral thrush include white patches on the tongue and mucous membranes. Other symptoms include redness and soreness in the mouth. Redness and soreness in the mouth can also be caused by a vitamin B deficiency, which can lead to angular stomatitis. Angular stomatitis is a condition that causes cracks to form at the corners of the mouth. Cracks can become inflamed and lead to pain and discomfort. Cystic fibrosis is a genetic disorder that causes the body to produce thick, sticky mucus. The mucus can clog the lungs and pancreas and lead to respiratory and digestive problems. Symptoms of cystic fibrosis can vary depending on the severity of the condition. Mild cases may cause frequent lung infections and digestive problems. In more severe cases, symptoms may include diabetes mellitus, clubbing of the fingers, and osteopenia. Clubbing of the fingers is a condition that causes the fingers and toes to become thickened and rounded. Osteopenia is a condition in which the bones become less dense and more likely to break. A purple tongue is uncommon, but can occur in people who have vascular or circulatory problems. Heart attacks, strokes, and peripheral arterial disease can all lead to a purple or mottled tongue. In addition to looking at the tongue, doctors will also ask about any changes in taste. A metallic taste in the mouth can be caused by certain medications, such as antibiotics, antidepressants, and high blood pressure medications. It can also be caused by chronic kidney disease, liver disease, and diabetes. If you have a sweet taste in your mouth, it could be a sign of diabetes. This is because the body breaks down sugar for energy. When it does, it produces carbon dioxide as a waste product. Carbon dioxide reacts with water to form carbonic acid. Carbonic acid then dissociates to form bicarbonate ions and hydrogen ions. Hydrogen ions increase the acidity of the blood. This is known as diabetic ketoacidosis. DKA can cause symptoms such as increased thirst, frequent urination, fatigue, and fruity-smelling breath. Dysgeusia is medical term. Dysgeusia is a medical term for a distortion of taste. Metallic, salty, or sweet when it isn't. Dysgeusia can be caused by a number of factors, including age, pregnancy, radiation therapy, head or neck surgery, sinus or nasal infections, dry mouth and zinc or iron deficiency. Geographic tongue is a harmless condition that causes the surface of the tongue to become red and map-like. It can affect people of all ages, but it is most common in adults. The condition is not contagious, and it cannot spread from person to person. The exact cause of geographic tongue is unknown, but it is thought to be genetic. There is no cure for geographic tongue, but the symptoms can be treated. This can be done with antifungal or anti-inflammatory medications. Some people have bumps on their tongue that make it feel rough or hairy. These bumps are called lingual thyroids, and they occur when the thyroid gland grows under the tongue. Lingual thyroids are benign, meaning they are not cancerous. However, they can cause problems with breathing, swallowing, and speaking. Lingual thyroids are usually diagnosed with a physical examination. Treatment is usually not necessary unless the lingual thyroid is causing problems with breathing, swallowing, or speaking. In these cases, surgery may be an option. So there you have it, guys. Now you know a little bit more about what your tongue can tell you about your overall health. Take care and see you next time.